right now, the system that we have, it's everybody's incentivized to do more. And the outcomes may or may not be there, but that's not where the incentives lie. The incentives lie in actually doing things, seeing them, spending time that is lucrative, that you can get reimbursed for, or doing procedures that generate revenue. That's the system that we have. We need to develop a system that's based more on outcome measures. And it's my belief, and the program that we have here has absolutely shown that, is that if you do integrative medicine, if you provide those kinds of modalities, it is extremely cost effective. But we're focused on outcomes. So the goal in integrative medicine is that we have an outcome as much by the patient's expectation and what they see as their goals as I do. So I'm not the person who decides what their goals are. They decide. And when we meet their goals, they're delighted, they're ecstatic. And so that's where the focus needs to be. And I very much have shown, and we believe, that if you do low-tech, high-touch interventions, you can have better outcomes, and the cost savings are enormous. And that's where I think integrative medicine will have its niche, is that they will become the cost-effective strategy for taking care of patients at a time where cost containment is a major issue. The incentives have to go from the disease management, or the disease intervention, the acute intervention, and have to back up and saying, how do we keep them from getting obese? So I believe there's not enough medication in the world that will fix diabetes. The only way you're going to fix it is going back and having the right nutrition, but that's not a short-term investment. That's a long-term investment, and it has all kinds of issues with the public, with the marketing, huge. But there's no solution other than doing that. So I think prevention has to be something that the people understand internally, that they don't go down a certain path. Once they're down that path, it's very costly and it's very hard to undo.